new patients. Dr. Patrick Lee, medical director of the Lynn Community Health Center in Massachusetts, underscored that point by quoting Teddy Roosevelt, "Nobody cares how much you know until they know how much you care." Second, patients who come in for regular checkups get invaluable preventive care. For example, Dr. Fine said that colon cancer could be virtually eradicated if everyone over 50 got regular colonoscopies. Colon cancer is a preventable disease, he said, and it rarely affects people under 50. He added that HIV/AIDS could also be eliminated nationwide by screening all sexually active men and women, and then stabilizing those infected to control the transmission of the disease. The screening, which is voluntary, costs about $30, he said, compared with the $400,000 lifetime cost of treating someone with the full-blown disease. Because of an emphasis on screening, Rhode Island reported only 75 new cases of HIV in 2014 out of a population of 1 million. And third, the regular visits help doctors to eliminate extra unnecessary and wasteful care. The doctors stressed that their regular patients never walk into their offices as strangers, perhaps needing a battery of largely useless and costly tests just to get started. "If I don't know you and you walk in sick," explained Dr. Fine, "we're starting at zero. But if I know you, chances are I have your problem diagnosed before you walk in." For more on the debate over annual checkups and my advice, go to Chapter 13, Don't Cough in the Doctor's Office Unless You Really Mean It. How long should you wait for an appointment? The most important point is this. If you have a serious symptom, the doctor should see you immediately. Emergencies aside, you should not need to wait more than 2 or 3 weeks for a checkup with a general practitioner and no more than 2 months to see a specialist. However, people on Medicare and Medicaid in particular can run into long delays based on the hundreds of dollars more the physician can collect by keeping private patients at the head of the line. Whatever the reason, don't accept long delays without badgering the doctor's office with daily calls, as I do, to see if a slot is open. Or if your primary doctor refers you to an elusive specialist for, say, your crippling back pain or a possible serious concussion, don't hesitate to ask your primary to help you get the earliest possible appointment. Doctors tend to refer their patients within informal networks of specialists and other providers, and the mutually beneficial referrals are reciprocated. The more a doctor recommends a particular specialist, the more likely the specialist might be to return the favor. Keep that in mind the next time you run into a delay seeing a provider your doctor recommended. Tell your doctor about your difficulty booking the visit and ask her to call for you. One call from your doctor should open the specialist door, as you'll find out in Maggie's story in Chapter 9, Pink Confusion, When Should Women Get Screened for Breast Cancer? The lesson: I believe strongly that a doctor who refers you to another has an obligation to help you actually see that physician. Do not hesitate to ask your doctor to intercede for you. How long should you have to wait in the waiting room? Lown doctors differed on this question, from no more than 5 minutes to 25 at most, but all of them said the staff should apologize and keep you informed about any delay. "I handed out coupons for coffee," said Dr. Fine, who tended to run late. That worked out for the patients in the coffee shop across the street. He also remembers being a bit too efficient when he took over his first practice from a revered rural physician famous for his 2-hour waits. "I cut my wait times to 15 minutes, and the patients went into an uproar," he said. "They had come to count on the other doctors' much longer waits to catch up with their neighbors. They didn't want to see me as much as they wanted to socialize." "When you finally see the doctor," said Dr. Lee, "he should shake your hand and explain exactly why you had to wait, even if his reception team has already done that." Many primary physicians book 20 to 25 patients a day, which works out to about 25 minutes per patient in a long day. They figure that some simple 10-minute visits will allow them to spend up to 45 with others. But emergencies do disrupt the best of offices, and overbooking plagues the worst. As a general rule, the older patients are, the more likely they will be to put up with long waiting times. In my experience, members of Greatest Generation especially are too forgiving toward disrespectful doctors, said Lown Institute President Vika Saini, a cardiologist who swore to me that he stayed on schedule 70% of the time. No matter what your age, if you find yourself sitting next to a couple of people who are also booked for your time, seriously consider not waiting around for an hour or two to see who wins the lottery to see that doctor first. Find a physician who does not overbook on the assumption that up to 1/3 of the patients won't show up, and if they all walk in along with you, that's your hard luck.